My name is Isaac Berlin, and I'm going to go over spondylosyndesis, or spinal fusion surgery, with you today. The spinal cord is a curved rod made up of smaller units called vertebrae. The first region of the spinal cord is the cervical region, which consists of 7 vertebrae. The second region is the thoracic, which has 12 vertebrae. The end of your spinal cord proper is your lumbar, which contains 5 vertebrae. The sacrum and the coccyx are below the spinal cord and are made of fused vertebrae. A useful tool to remember the vertebrae is, I had breakfast at 7, lunch around noon, and dinner at 5. The most common indication for spondylosyndesis is for pain in the spinal region, lumbago, or pain in the lumbar, trauma, scoliosis, and abnormal curvature of the spine, or kyphosis, a hunchback. The first type of spinal fusion surgery is posterolateral surgery. In this surgery, a surgeon will typically take bone from the iliac crest, or the hip of an individual. The bone is then placed in the transverse process of the vertebra. The graft is then anchored with metal screws, and a wire will wrap around the pedicles of the vertebra for further support. Inner body fusion places the graft, also taken from the iliac crest, where the intervertebral disc lies. The disc is removed, and a titanium clamp will usually keep the space open. The two endplates of the vertebra are then fused together. If both fusion surgeries are performed together, they are known as a 360-degree fusion surgery. One challenge in spinal fusion surgery is proper anesthesia. The spinal cord is a very sensitive area filled with many crucial nerves. If a surgeon makes a mistake, the patient could be paralyzed for life. It is crucial that a team of trained surgeons with full concentration perform the surgery. The anesthesiologist must have a careful balance between anesthetizing the patient and ensuring that the patient is getting enough oxygen. Too much anesthesia can decrease lung function. Too little anesthesia could cause paralysis, which can be excruciatingly painful. Another issue is that the surgeons need to be careful not that too much blood is lost. Contraindications to spondylosyndesis include bone morphogenic protein and thrombocytopenia. Bone morphogenic protein, commonly used for oral surgeries, will cause a swelling of the soft tissue if used near the spinal cord. The swelling can cause undue pressure on the meninges and even result in death. As with all surgeries, thrombocytopenia is a contraindication. Thrombocytopenia is a condition of too few platelets, which affects clotting. If an individual can't clot, they will most likely die of blood loss from the surgery. Recovery from spondylosyndesis typically takes between 6 weeks and 3 months. During this time, it is important to not bend, twist, or lift any excess weight. Rest is crucial, as well as taking care of your health. Proper hydration and avoiding smoking are crucial to prevent inflammation in the area. NSAIDs, or non-steroidal anti-inflammatory drugs, are typically prescribed post-treatment. Rehabilitation is also vital on the road to recovery, and physical therapy is a common treatment as well. I would like to thank you for watching my presentation, and I hope you learned a thing or two. If you have any questions, please send me an email at iberlin106@gmail.com.